My name is Dr. Deborah Wilson, and I'm here to talk to you about prolapse. So, when a woman is born, she has a good support system in the pelvis. The uterus is supported, the pelvic floor is supported, the bladder is supported, the rectum is all supported. It has fascia or gristle around it. In fact, the vagina is encased in a tube of fascia, very much like gristle. But in the vaginal delivery process, sometimes these support systems, these layers of fascia are actually violated as the baby comes through the vaginal canal. And if a woman has large babies, long labors, a number of babies, the bigger the baby is, the more babies she has, the more at risk she is for what we call pelvic prolapse. So again, these fascial support systems are very effective until a woman puts a baby through. So and usually she doesn't notice the prolapse, the problem with the breaks in the fascia right away. It'll take years sometimes of gravity and tissue disintegration and just general aging to start feeling the effects of those deliveries. So, and in an extreme situation, women will start to feel actually something coming out of the vagina or a lot of pressure in the pelvis. So she needs to see her gynecologist, and the gynecologist needs to evaluate, what's going on. So, oftentimes when a baby comes through, the break in the fascia happens between the vagina and the bladder, the vagina and the rectum. So she can get bulges out through the vagina. So the rectum can actually push out through the vaginal canal because the rectum is a high pressure organ and the vagina is low pressure. Same thing with the bladder. The bladder is high pressure and the vagina is low pressure. So they can actually push out. The rectum and the vagina aren't really coming out through the vagina. They're pushing the vaginal skin or vaginal epithelium out. And a woman can start to actually feel like, something coming out, like an egg coming out, or a piece of tissue. Also, the uterus doesn't have the same support system, so that can start to drop. So there are a number of surgical techniques that can help with this prolapse. And there are also laser techniques that can help with the prolapse. So erbium vaginal laser can actually tighten the tissue. So in a situation where the prolapse is just mild or even moderate, the vaginal laser, erbium vaginal laser, can actually tighten up that tissue and take away many of the symptoms of the prolapse. In a more extreme situation, a woman needs to consider having a hysterectomy if her uterus is still there. If her uterus has already been removed, she can have vaginal repair of what we call the rectocele, or that bulge between the rectum and the vagina, or cystocele, or the bulge between the bladder and the vagina. So these things can be addressed vaginally. In an extreme situation where the vagina is really inverting and it's severe prolapse, we recommend something called a laparoscopic sacrocolpopexy, and this involves a piece of mesh type fabric that is actually sewn into the top of the vagina and then brought under the bowel and pinned to the sacrum, so the whole vagina is pulled up. Now this technique is technical. Not a lot of surgeons are adept enough or trained enough to be able to offer this technique, but it is a very good technique for the extreme prolapse situation. But again, that's a little bit rare. Usually, say if a woman has a uterus still, we can remove the uterus and we can make incisions in the vagina so we can correct the rectocele and the cystocele. So if you're a woman who feels a lot of pressure in the pelvis, and maybe you feel something coming out, particularly when you've been on your feet for a while, or when you're taking a shower, you notice there's some tissue there, you want to see your gynecologist and talk about these various options. Erbium vaginal laser in a relatively mild situation will make all the difference in the world. Hysterectomy with cystocele and rectocele repair can correct the problem. And in an extreme situation, the laparoscopic sacrocolpopexy can be employed to hold up that vagina so it never falls out again. So, don't be quiet about it. If you feel a lot of pressure, if you feel something coming out, go see your gynecologist and talk to your gynecologist about these various options, because you don't have to be uncomfortable. I mean, prolapse never killed anybody, but it sure can compromise one's comfort level and, one's willingness to stand on their feet for a long period of time. Thank you very much.